Okay, so let's talk about one of those medical procedures that causes infertility, removing testicles to cure testicular cancer, which, as we've seen, has good and bad effects. So the principle of double effect would apply. So we're especially concerned here with the object and the consequences. Okay, so have we passed the first criterion? The object is not bad.
Yes.
Okay. All right, well, what's the object here? Does anybody know? Yes.
The object would be to remove the testicles.
Okay. That's right. That's right. So is that bad in itself? Not necessarily. It's certainly not one of those objects that the church teaches is always wrong, like murder or rape. So yes, we've passed this criterion. Have we passed the second criterion? Do we desire the good effects and not desire the bad effects? What do you think? Okay. Yes, presuming you don't desire to cause infertility. Right, that's the bad effect. You've passed that one. Have we passed number 3? Does the bad effect here cause the good effect? No, right? Does everybody see that? The infertility itself does not cause the curing of cancer, the good effect. So we're okay. The bad effect does not cause the good effect. And have we passed the 4th criterion? Does the good effect, is it equal to or outweigh the bad ones? Yes, okay. So curing cancer and therefore being able to survive, right, that's a very good effect that outweighs the loss of fertility. So this procedure is considered morally permissible as long as the benefits outweigh the costs, which was the case here. One could also add the condition that in order for the action here to be permissible, there must be no simpler therapy available that would maintain fertility. In other words, if you can find an action with little to no bad effect, you'd obviously prefer that one. And so in the endometriosis case, for example, NAPRO technology is something that treats the underlying condition better. And so it would be preferable to taking the birth control pill. And as sort of a side note here, I was informed during the break that when it comes to the birth control pill, apparently it's been classified by the World Health Organization as a group 1 carcinogen, along with things like tobacco and asbestos. So that poses some danger to the mother's health. And so that these are sorts of things you'd want to consider as well, at least in the endometriosis case. Okay, what about the use of condoms by married couples to prevent the transmission of HIV/AIDS? Well, remember, I'm going to sound like a broken record at this point, according to Catholic teaching, all 3 elements, object, intention, and circumstances, must be good for the entire act to be good. Okay, what's the intention here? Does anybody know? If a married couple is using a condom to prevent HIV transmission, their intention is what?
It would be to protect their spouse from getting the disease.
Yeah, that's right. A couple different ways you can phrase it. That's certainly one way you could phrase it, right? To prevent the spouse from getting their disease, to prevent the transmission of HIV/AIDS, to prevent infection. Okay, is that a good intention? Sure. And the circumstances we'll assume are good. They're married, presumably, and not having sex in public, as was the case with the previous example. Okay, so let's assume those are good. What is the object, though? This one maybe is a little harder. What do you think?
I guess the object could be wearing the condom or the using some sort of contraceptive to protect the other person.
Okay, yeah, actually I think those are the 2 main ways you can phrase it. Let me distinguish between both of those. Okay, what is the object? Some might say it just involves using a condom or wearing a condom in order to have sex, but not contraception. Is using a condom always bad? Not necessarily. As one moral theologian, Martin Ronheimer, argues, quote, condoms cannot be intrinsically evil, only human acts. Condoms are not human acts, but things, end quote. But another way to do it, others, such as moral theologian Nicanor Austriaco, suggest that the object here is actually contraception, which I think was a word you used in your answer. In other words, rendering a fertile act infertile. And as we've seen, this object is always bad from the perspective of Catholic teaching. So, I know this is confusing, but because of apparent disagreement among moral theologians as to what exactly the object is in this situation, the issue is disputed. Another way to put it is this: if the object is contraception, then we have run afoul of one of the general guidelines that we went through before. In other words, we have freely chosen sex that's not procreative. But if the object is not contraception, then we're acting in accord with that guideline. In other words, the freely chosen sex can still be fully unitive and procreative. So anyway, the main point here is the issue is disputed. The Catholic Church has not officially pronounced on it yet. So Catholics can come to an informed conclusion using the virtue of prudence, which we talked about before. However, one additional thing they'd want to keep in mind: condoms are not 100% effective in preventing the transmission of HIV and AIDS. And this information should certainly be considered when deciding whether or not to proceed with using one. The previous two examples deal with cases where any contraceptive effect is either unintended or at least arguably so. But what about the case of rape? Can a woman ask her assaulter to use a condom, or can she use spermicides or anti-ovulatory drugs after the fact in order to prevent conception? The answer is actually yes, according to many Catholic ethicists and the United States Conference of Catholic Bishops. The idea is this: the idea is that, in other words, that the woman is not contracepting, according to the definition I provided earlier, since she hasn't engaged or planned to engage in a freely chosen sexual act with her perpetrator. Or to put it another way, she hasn't run afoul of the guideline that freely chosen sex must be fully and unitive and procreative, since we're not dealing with freely chosen sex in the first place. Allowing her to prevent conception enables her to protect herself against a further violation of her dignity. However, keep in mind that such prevention is permitted only if the woman has been tested for pregnancy and there is no evidence that conception has already occurred. And I should add, with certain forms of such prevention, such as the drug Plan B, there's debate whether or not it poses an unacceptable risk to the life of an embryo, and therefore whether one may illicitly use it in cases of rape. If conception has occurred, or there's a quote-unquote unacceptable risk, the woman may not abort, according to Catholic teaching, and she should not use these drugs because this would be a violation of the dignity of the newly created person. In other words, some have argued that here you have a sort of double violence, quote unquote, one that might in turn cause further distress, at least in some cases. So more specifically, for example, I came across one study of women who had been made pregnant through rape. Some of those who carried the pregnancy to term expressed the belief that they would have suffered even more by ending their child's life. So from their perspective, at least, it was in their own interest to actually go through with the pregnancy. While the Church's view on abortion in cases of rape strikes many as harsh, it is important to note that in an Evangelium Vitae, John Paul II bent over backwards, so to speak, to reach out and offer some caring words to women dealing with pregnancies in difficult situations. And here are some words from near the end of that encyclical letter. Evangelium Vitae, by the way, just means the gospel of life. The Pope was basically addressing various issues in medical ethics here. So here's what he says near the end. Quote, "I would now like to say a special word to women who have had an abortion. The Church is aware of the many factors which may have influenced your decision, and she does not doubt that in many cases it was a painful and even shattering decision. The wound in your heart may not yet have healed. Certainly what happened was and remains terribly wrong. But do not give in to discouragement and do not lose hope. Try rather to understand what happened and face it honestly. If you've not already done so, give yourselves over with humility and trust to repentance. The Father of mercies is ready to give you his forgiveness and his peace in the sacrament of reconciliation. To the same Father and his mercy, you can with sure hope entrust your child." Okay, so again, in closing, prevention of conception in victims of sexual assault permitted as long as the woman is not pregnant, that there's no evidence she is. If she is pregnant, the Church would be opposed to abortion in that case, as in other cases.